30 years on from the outbreak of the epidemic, the face of HIV and AIDS in America has changed. Black American men are now infected at a rate 6 times higher than white men, while women from ethnic minorities are at increased risk. It's especially difficult in the nation's rural areas where access to treatment is often a challenge. We take you to one of the poorest states in America, Louisiana. There are two sides to the state of Louisiana in America's deep south. There's world-famous New Orleans, jazz and tourism. And then there's crushing poverty and struggling neighborhoods. Angus Carter has always lived on the wrong side of the tracks. Here in Louisiana, one of the poorest areas in the United States. A few years ago, times were even harder for him when illness struck.
I found out that I was HIV positive in prison. Once I was released from prison, I was released from the Department of Public Safety and Correction sick. Throwing up, sick, barely could walk.
46-year-old Angus got caught up in petty crime as a young man and became infected with HIV after shooting heroin and sharing needles. Meanwhile, Mimi Alvarado, who moved to Louisiana from Nicaragua in the mid-1970s, was infected with the HIV virus by her male partner 13 years ago and now lives with the consequences. Angus and Mimi represent the current face of HIV and AIDS in America. What began 30 years ago as a virus infecting mostly homosexual men on the country's east and west coasts is now a disease that disproportionately affects the nation's ethnic minorities, like blacks and Hispanics. Although African Americans represent only 13% of the country's population, they account for 46% of people infected. Many say the stigma and shame is as prevalent as ever, but that treatment hasn't kept pace with the need.
This was my walk, to catch the bus, to go receive treatment from the AIDS Council or the hospital. And if you got AIDS, this sure ain't a short walk.
In the United States, the poorest people like Angus receive free health care under a publicly funded program called Medicaid. But in some regions, accessing the actual services is not always easy, especially in low-income rural areas. In fact, Angus's clinic is the only one in the whole of southwest Louisiana that will see HIV and AIDS patients under Medicaid. This in an area half the size of Belgium.
I am the only one physician that does infectious diseases in southwest Louisiana.
Dr. Carlos Chaucino is the clinic's sole physician. And what happens if he has to miss work?
That happened only one time. I was sick for 3 days.
A long time for patients like Angus, who depend on Dr. Chaucino to provide them with life-saving antiretroviral drugs, a proven treatment for HIV infections.
I'm trying my best, but seriously, Dr. C, my jaw swole up, they hurting, my headaches, they there.
Still, Angus is one of the lucky ones. 1/3 of people with HIV infections in Louisiana, a state with one of the highest rates of AIDS in the country, have had no treatment in the last year. In 2010, the government did launch a new strategy to expand health care for low-income people with HIV and AIDS. But Dr. Chaucino believes that rural areas are still lagging dangerously behind.
The money does not follow the epidemic. Whenever the federal government decided to put some money into the care, the money went to the big cities where the disease was. But the epidemic has moved south.
After being released from prison, Angus was able to move on with his life. He married his second wife, Charlotte, in 2004, combining their families.
He was actually here in a halfway house, and I was working there, and that's how we met. We have 2 grandchildren that are 7 and 4.
Charlotte is not HIV positive, but she knew Angus was when they married.
Being married to a person that's positive, it's a struggle. I want to do more, but I can't. There's nothing, with his illness, I just need to help him more, but I don't know how.
Unlike Charlotte, 53-year-old Mimi Alvarado didn't know her partner was infected when she contracted HIV from him. Since the advent of AIDS in America, the risks for women have increased substantially. Now, 1/4 of all people living with HIV in the United States are female. And the rate of HIV infection among Hispanic women, like Mimi, is 4 times higher than the rate for non-Hispanic white women.
Thursday, Friday, Saturday, Sunday. And here's the meds. This is the HIV meds, dinner, and before I go to bed.
Mimi, like Angus, receives antiretroviral drugs, and her treatment is mostly provided for free under Medicaid. But not all her medications are covered.
I used to get this for free. Now I'm paying. My paycheck is very, very little.
In the current economic downturn, the state of Louisiana, like most states in the nation, is facing serious budget shortfalls, and that's affecting healthcare, says Deanne Gruber, director of the state HIV program at the Louisiana Department of Health.
We did have to make some very difficult decisions and reduce some of our contracts with our community-based organizations and service providers in order to, look at cost containment compared to trying to provide everything for everybody.
And providing health care to people living with HIV is expensive. The drugs alone cost some $25,000 a year per patient.
The math doesn't work.
Eric Sawyer is an advisor at UN AIDS, the joint United Nations program on HIV and AIDS.
You can't have a flat budget for HIV medications, an ever-increasing number of people living with HIV in the U.S., and an ever-increasing price level for those drugs. Those drugs don't stay flat.
In Louisiana, this means that hundreds of people are on a waiting list to receive drug treatment for HIV and AIDS.
If you see in the South here especially, all these states in purple, they are states where people are on a waiting list to get HIV medications.
Mimi did make it past the waiting list, but her life still isn't easy. Working a few hours a week for a support group for women with HIV and AIDS, she lives from paycheck to paycheck, and she constantly struggles to find enough money for all her medicine and food. This morning, Mimi heard from a friend that a charity on the outskirts of New Orleans is giving out $10 vouchers to those with low incomes. She's ready to spend all day standing in line, but only 15 people will get a voucher.
9, 10, 11, 12, 13, 14, 15.
They're only taking 15, so that means I'm not getting nothing and I'm been waiting here.
Mimi's children are now grown up. From time to time, she talks on the phone with a daughter who moved to the nearby state of Mississippi. She's never told her family about her infection.
My children and my mom, they don't know about my HIV. Eventually, I'm going to tell them. But it's one of those things, when is the right time?
Both Mimi and Angus have had to face down illness, stigma, and poverty. Both are waiting for their access to health care to improve. But both remain equally determined not to be defeated by the disease and to look forward.
Some people can't handle being looked at as if they are a disease or a plague or something less than human. I know the feeling, I've been there. There's a lot of people that don't realize that AIDS isn't the end of the world. I've been living with it for 19 years, and I'm still here.